Estrogen dominance. When searching for information about hormone imbalances, it's likely you'll come across the term estrogen dominance. Estrogen dominance has emerged as a buzzword over the past 10 years and is often used to describe a hormonal imbalance commonly observed in women. It should be noted that estrogen dominance is not a medical diagnosis, but rather an umbrella term that encompasses the symptoms that occur when estrogen is elevated relative to progesterone, its balancing counterpart. The symptoms of estrogen dominance in women and people who menstruate include short or irregular menstrual cycles, painful periods, mood swings and irritability, cyclic breast tenderness, heavy periods, breast cysts, anxiety, and weight gain. And for men, it includes enlarged breasts, sexual dysfunction, and infertility. While estrogen dominance is not a standalone condition, it is a pattern that many functional medicine practitioners observe and practice. In order to understand the theory of estrogen dominance, we have to go back to the basics. Estrogen is a group of hormones that are important for our menstrual health and fertility, protects our bones, and supports cognitive health. It is one of the hormones that keeps us feeling youthful. Estrogen is also proliferative in that it makes tissues grow. If we remember back to the menstrual cycle, estrogen is what causes the lining of our uterus to thicken, whereas progesterone allows it to mature. Progesterone is a hormone that suppresses estrogen. It keeps it in check and restrains excess growth. So while adequate estrogen levels are important, too much estrogen in relation to progesterone can cause issues. So why does this happen? The truth is there is not one single cause of what may be labeled estrogen dominance. There are multiple. Elevated estrogen activity can happen secondary to certain conditions, such as PCOS, or may be a result of normal fluctuations in hormones with age, such as perimenopause. Some of the proposed or observed causes of estrogen dominance include, in general, suboptimal hormone metabolism, gut dysbiosis and low-fiber diet, elevated estrogen exposure, and alcohol consumption. For those pre-menopause, failure of ovulation, such as due to PCOS, and perimenopause. And those post-menopause, excess body fat and inflammation. So how do you determine if you have estrogen dominance? Well, if you suspect that you may be experiencing symptoms of estrogen dominance, it is important to investigate with a healthcare provider. The multiple causes of estrogen dominance further underline the need for individualized care. This starts with identifying why you're experiencing these symptoms. Is it poor estrogen metabolism? Is it PCOS? Are you in perimenopause? Certain conditions should be ruled out or diagnosed and treated. The functional medicine approach to addressing estrogen dominance starts with identifying the root cause, gaining a detailed history, using comprehensive testing, and building a plan to restore function within the body and to balance hormones. The beauty of addressing estrogen dominance from a functional medicine approach is that we have a lot of tools to use. So stay tuned for more videos about estrogen metabolism and hormone health, and add any questions or comments to the comments section below. Thank you.